That talk was money in the bank for you, and perhaps the most important pieces of information as you start your career. So the first talk was what to look for. The second talk was how to get it, and the third talk is basically how to keep it. I was very happy to introduce Brent Matthews, who's professor of surgery at Wash U in St. Louis. He's the chief of minimally invasive surgery there, and he's a veteran of this session. I think this is his third time. I keep asking him back because his advice and his ideas are so good. So Brent, thank you, and interested to hear what you have to say.
Thanks, Blair and David. I think it's because I've made a lot of these mistakes or fell into some of these pitfalls. This is my email address, and certainly if anybody wants a copy of this talk, please email me. I'd be happy to send it to you. I'd be remiss if I didn't thank my mentors and people I've worked with in the past, both as a resident, a fellow, a junior faculty, now kind of the midpoint of my career, who guided me through this and taught me a lot of these things, and when I fell into some of these pitfalls, steered me in a different direction. I'd also like to thank a lot of the trainees that I've worked with that have enlightened me about some of these issues. These are my disclosures. There's nothing relevant to this talk. So what I'm going to do is go through 10 what I think are pitfalls and give you some kind of key words or phrases, I guess in a similar fashion to David Letterman, that hopefully you'll take away from this talk in terms of avoiding problems. So the first thing, pitfall, is going to the place that pays you the most money, not the place that has the most money. It is worth leaving $20,000, $30,000, $40,000 on the table in a contract to go to an environment that has the resources that are going to make you successful. Because as you become successful within that academic institution, the value is going to be quite apparent. And as your value becomes apparent, they're going to want to keep you and compensate you and make up for that potential lost compensation that you left on the table. So don't get too short-sighted. I've seen this in recruiting people, that they're so concerned about the dollar amount on their initial salary and not what the resources that are really going to be available to them to make them successful. The other part about this is in academics, as people advance, sometimes that requires a change in their environment, so they transfer to another institution. And being positioned in a place where you're successful to have continued success as you advance to another institution will be very important. And you may make up for that compensation by your second contract as you advance throughout your career. The second one, and this was really highlighted in Julie's talk, and that is leaving the station without a career map. Preparation means everything, so that when you hit the door, you hit the door running. So even prior to coming to that institution, you've really mapped out what your career goals are, whether they're educational, clinical, research, and again, this is focused towards the professional aspect of your career, and making sure that you meet with the appropriate people, you have the appropriate mentorship, you have the appropriate collaborators, you're in an environment that will allow you to develop your clinical skills. You'll have collaborators and mentors to help you in that. So certainly leaving the station without a career map is a major pitfall. I think the tragedy of potential, and having been in practice 12 years now, I understand this a lot better than I did when I first finished and got out into practice. You know, most academic surgeons are hired based on their potential. And you don't want the peak of your career to be that potential that you were hired for as a chief resident or as a fellow. You have to remember an academic career is really a 25, 35-year process, and you have to pace yourself appropriately so that you develop in an appropriate manner. You don't want to peak the first or second year you're in practice. You don't want the greatest moment of your academic career being this research you did as a resident, and people hired you based on this potential, and you never really developed. This is a very interesting book called First, Break All the Rules, and it's really about hiring people and Fortune 500 companies' philosophy about hiring people. When they surveyed these companies, what they found is that most companies don't expect to develop weak areas of performance and habits, so that if you have an area of weakness, those companies don't expect to bring you in and make those areas much better. What they really want to do is build on what your existing great qualities and talents are. And I think to be successful, you really need to leverage what your talents are. You know, not every prospective employee has unlimited potential, and so you have to be realistic about what your potentials are. And those can be defined, those qualities can be defined. You can develop plans with metrics, and as Adrian talked about, those metrics, when they're hit, can lead to greater compensation or resources. But don't overpromise and underdeliver, and so the tragedy of potential is real. The next one is that you need a title to be a leader. I think leadership is something that may be innate, and from the day one when you start in an academic career, you're leading a lot of different people. Certainly you may not be leading other surgeons and things in that manner, or having a formal administrative role, but you are the leader of a team. That may be a fellow, that may be a resident. All these people you work with within the units, within the operating room, and many of this may be educational, but people look to you as a leader. And so, you know, genuine leadership is not characterized less by one's resume and power over people, but more about one's legacy and power with people. So these qualities of leadership credibility really occur even though you don't have a formal title. And we see this quite commonly, that people want that title to get that credibility, but the credibility really comes before the title. The next one is, and I've learned this, I would say the hard way, is that your self-worth is not defined by the number of citations on PubMed. I think the quality of the work is so much more important than the quantity of work. I know in our own institution that you could publish one paper a year, but if you publish a high-quality study that really makes an impact in the way people take care of patients, that is more valued than publishing 12 papers and the amount of time and effort that goes into doing that. So again, I think the quality of the work is so much better than the quantity of the work. And I think universally that is well accepted, at least by credible academic institutions. This quote that some authors should be paid by the quantity, not written, is anonymous, but I'd like to be able to put my name by that. Next pitfall is that you gain privileges with membership. Of course, the American Express trademark title that came out in 1998 or 1988 or 1989 is that with membership you have privileges. It is really not appropriate for an academic surgeon. You think about it as a resident, and you don't have continuity of care. You rotate from service to service. From a behavioral professional standpoint, I would say that you have a little bit of laxity or leeway compared to some of the faculty who obviously have more responsibility. That really, as you become a faculty member, the privileges that you had as a resident go away, and that's really imposed, but based on the amount of responsibility that's required of a faculty member. So remember, rank does not confer privilege or give power; it really imposes responsibility. So even though you gain membership by becoming a faculty member, you don't necessarily gain additional privileges. This one is the pitfall is that entitlements are for academic surgeons, not a government welfare program. I think Adrian really talked about this, in that as you negotiate your contract, certain resources that are going to be available for you should be well defined. I think we see a lot of surgeons who start out in an academic career who just assume that they have access or benefits, that it's an established right of being an academic surgeon, and these need to be defined. You certainly become very disenchanted or when those resources aren't available because you felt it was an entitlement of your job. I think Julie hit this, and that is the failure to continuously re-inspect your expectations is something that is a problem. You have these expectations of how things are going to evolve, and they may not evolve that way, and that may be based on changes with you yourself, changes within the environment, how the academic institution is doing from a financial standpoint. So I think you need to continuously re-inspect your expectations and ensure that you're not expecting entitlements, that these are actually things that have been negotiated and they're realistic and available in your environment. I think avoiding the no assholes rule is actually something that our department is taking very, very seriously, and that is professional behavior. The environment has changed. I started as a resident in 1993, and even in this short period of time, things have changed drastically in terms of the responsibility of your professionalism within the workplace, especially in an environment where in the past many surgeons had leeway to act with very unpleasant behaviors in any manner they did, but because of their reputation and their clinical volume and the things that they had published, they got a pass. But that's really not going to hold up as we move forward in the future. So this book, The No Assholes Rule, I think is a really good book in terms of describing bullying behaviors in the workplace and how it worsens morale and productivity. As quality measurements become more important, and as Adrian said, we're not exactly how those are going to be measured. Working as a team and having a better work environment is going to be extremely important. And so poor behaviors, whether it's one of these 12 or something else, is only going to sabotage that work environment. So I think you have to take a step back and really have some insight into professionalism. Now, any of you who have a father-in-law who thinks this is funny to send your daughters these books as they develop may have seen these before if you have kids. This is a quote that that a attending gave to me as a first-year resident, and I've never forgotten this quote. And what he told me is it's okay to poop in your diaper, you just can't play in it. And I think this becomes very, very important, not only as a trainee, but as a junior faculty. And that is that no one's knowledge can go beyond their experience. As a junior faculty, you're still clinically developing. Your clinical skills will certainly don't peak as a resident, and your judgment really changes with time. And when you get yourself into a situation that you need help, ask for help. You're going to learn a lot better. Patients are going to get the most appropriate care, and that acknowledgement that you need help becomes very, very important. And so as a junior resident making a mistake that I could have avoided by asking for help, the attending told me, Brent, it's okay that you poop in your diaper, just don't play in it. And I didn't understand that, and now I have 2 daughters, and I completely understand what they mean. Again, this is something through mentorship where you get professional advice, guidance, and counseling becomes very important. I've been in practice 12 years. I do a lot of advanced surgery, advanced foregut surgery, and there's rarely a week that goes by that I don't ask for help or ask for guidance from other colleagues of mine that have a lot more experience or have talents that I don't have that I think are best for patient care. This is a pitfall that we see quite commonly, and this can happen throughout any time in your academic career, but that is becoming a high-maintenance, low-volume surgeon. To be in academic surgery, you don't have credibility unless you're clinically active. I've heard Adrian say that before, and I completely believe that. You have to remember that when you come into a new institution, there's already an established environment there. These people have been working in that institution, in that environment for years, sometimes decades, and they have certain expectations on how things will work or how they work within that institution. Now, being high maintenance are usually those people that are more demanding, more independent, vocal, and more likely to challenge the status quo. It's not that that is not okay to be more independent and not challenge the status quo. I think you just have to be sensitive of how you do that. But if you're not involved and you're not around and you're showing up once a week and you have these kind of professional behaviors, you won't develop respect, you won't develop trust. Communication between you and the work environment will obviously not be adequate, and that can certainly lead to very difficult time as you transition as an academic surgeon. Again, that's my email address. I'd be happy to email you the talk and talk to you afterwards or talk during the question and answers. Thank you.
Thank you, Brent.